Alright, so this is right after my PRK. It wasn't too bad. I guess I'm real sensitive with my eyes, and the doctor said that I was his worst patient ever. So that was real encouraging. But I'm not real light sensitive just yet, but I don't want to take any chance of, taking off my glasses because it doesn't feel bad and then regretting it later. So I'm just leaving them on for now. My eyes are still numb. I just got back from my appointment, and it really wasn't too bad. What they did, I'll try to go through it as detailed as possible. That way you know exactly what to expect. Okay. Now this is how it works in the Army. Like I said, I am in the Army, and it was kind of like rushing cattle through. Okay. They sat us down at 6:45, gave us this briefing telling us, what to expect, and our vision will go in and out. You could have double vision, blurriness, things like that, things to watch out for, how to take the medication, when to take the medication, and all that. So, yay, I got it done. It did suck though. But pretty much, they bring you in. Well, they have you take a Valium, or a similar pill to a Valium. It's 5 milligram, about an hour before your surgery. So I took mine. It didn't really affect me much. I guess it's not really to calm your nerves. It's just to make you hold your eyes still. Kind of helps with that. It didn't really help me too much though. So first what they did was they pried open my eye, gave me some numbing drops. They actually, because of how bad I was, they gave me 4 times the amount as the other patients. And that doctor officially hates me now. He said he never wants to work on me again. So they give you the numbing drops, and then they put these clamps in your eyes. And the clamps pretty much just hold your eyes open. As you can see by other videos where people were allowed to actually videotape themselves getting the surgery, it just clamps your eyes open. You can't blink. I kept trying to blink really hard, like I don't know if you get scared or something and your eyes just clench really tight. I was trying to do that the entire time, and he was getting pissed at me. But pretty much they just clamp open your eyes. At that point they gave me some more drops, and then they took this brush. It's kind of like an electric toothbrush that spins, and they just went all over my eye. That wasn't too bad. The only thing that I could feel from that was the pressure, where he was kind of pushing. He wasn't pushing real hard, but I could just still feel the pressure in like the back of my eye socket. And so he did that. That took a little while. That actually took longer than the laser was shooting in my eyes. So he scrubbed a little bit off, and then he had me. And whenever they scrub it off, just relax, completely relax, because if your eye starts to roll up or something, they get pretty pissed at that. But then I had to look at this blinking red dot after I was under the laser. This blinking red dot inside in the very middle of the laser, and you just stare at it and kind of zone out. And then they started a countdown. I guess each eye took a different time, for which the laser was on it. And, they were counting down, and my right eye took 11 seconds. My left eye took 13. So it's really fast. It's nothing really. I just stared at that. This was the creepiest part. They say it's the ozone burning, but I call bullshit, because it smelled like burning flesh. Like if you burn your hair, that awful smell, that's exactly what it smelled like. And it was horrible, but whatever. I freaking... But let me see. And then the absolute worst part of it was after the laser was done, they sprayed this water all over my eye, and it sucked because I could not hold my eye still. My eye kept trying to roll back in my head. And then again, he was getting pissed. So, and during the time that they're doing the right eye, the left eye has this metal shield over it to protect it. And so they sprayed the water, and then they gave me like 5 or 6 drops. I don't know what the drops were. They were probably like an antibiotic or something like that. But 5 or 6, one at a time. She would show the bottle over my eye, drop it, and take it out of my field of vision. Show it, drop it, take it out of my field of vision. So, I mean, she didn't really give me a whole lot of time to like hesitate with it or freak out whenever I saw the bottle. So she was pretty good that way. And then, let's see. Then they took off they moved the laser over. They took off the shield off of my left eye, put it over my right eye. And then they did the exact same process to the left eye. And then after I was done, after they squirted the water, did the drops, they took the clamp out, had me sit up, and I walked to the door. My vision was pretty good for about 10 seconds, and then it just went to shit. Right now it's shit. It's better than before without glasses, but it's still not perfect. I'm trying not to squint a whole lot to see stuff because I've got these. Oh, that's the stuff that I forgot. Okay. After all the drops were done, they put a contact lens in, a bandage contact lens. That's going to stay in for 5 days. I have an appointment in 5 days to get that taken out and to see how I'm doing. They may leave it in. They may take it out. I don't know. It all depends on my healing. Usually I'm pretty good at healing, so, you know, whatever. I guess if that's a skill to be good at, I'm good at it. Whatever. But, other than that, it was really no big deal. I just made a bigger deal out of it than what was really necessary. They gave me these shades. They also gave me these, which I don't know how well you can really see those, but that's for sleeping, because you don't want, it's a natural reaction that whenever you wake up and you feel something in your eye, you're going to rub your eye. We don't want to do that because it'll let the contact lens will pop out. They told me no reading, no getting on the computer. Oops. None of that fun stuff. And they also told me to take a Vicodin exactly 1 hour after the surgery, which my time is up. I should be taking it, but I'll finish this video first. They gave me 3 kinds of eye drops. One of them is just kind of an over-the-counter. It's called a Refresh Plus. They come in boxes like this, and it's actually these individually wrapped eyedroppers, which they say one-time use, but there's a lot in there. You can use them more times. They even tell you don't waste them. Just you know, you can twist off this top. I've already used this one a little bit, so just twist off the top. And that's sterile, so you don't ever want to run water or drop it. If you drop it, just throw it away, okay? And then this topper can actually just fit right back down on there. And they're really not that bad. Maybe it's because my eye's numb or whatever. They also said it's real handy because it's going to hurt for the first 3 days at least to put a couple boxes in the refrigerator. So I just did that, put them in the refrigerator, let them get cold, and it just feels a lot better on your eyes. Now they said if you can use these eye drops every 15 minutes, do it, because that determines how well your eyes heal. Okay, the more moist you keep them, the better they're going to feel. They also gave me these antibiotic eye drops that I'm supposed to take until my first appointment, which is in 5 days. And then they'll see where I'm at from there. And then steroid eye drops, which are going to last like 30 days. If not even longer. Just trying to think. They give me Vicodin, 30 pills of Vicodin. They are, let's see if I can read this. They're 325s. They said I can take one if I take one pill at a time, I can take them every 4 or 5 hours. If I take 2 at a time, I can only take them every 6 hours. So I'm probably going to be doubling up because pain meds don't really affect me a whole lot. So, what else? It really wasn't bad. Don't be freaking out. My suggestion is quit watching videos like this because everyone's experience is different. I'm probably at the worst end of the spectrum because my eyes are so damn sensitive. But other than that, it's cakewalk. It really is. The worst part is sitting there waiting, listening to the laser go off before it's your turn. So that kind of freaks you out. But other than that, the staff was really nice, except for the doctor. He was pretty pissed. But oh well, I got it done. No more glasses. No more sunglasses. I'm real excited. I'm going to lay down here and probably call my folks and then take a nap because they said the best thing you can do for the first 3 days is try to sleep through the entire 3 days because it's going to hurt. And your eyes will naturally lubricate themselves while you're asleep. And this visor also helps trap in the moisture so that your eyes don't dry out while you're asleep. Wear it. No matter how goofy it looks, no matter how dumb it is, wear it. These are your eyes. You need your eyes. Do not screw around with your freaking eyes. They showed us this picture of this guy that quit taking the steroid drops, which helps you heal. And he quit taking them after like 4 weeks. He quit taking them, 4 or 5 weeks. And he went in 10 weeks after his surgery. And they, because his eyes had glazed over, kind of like cataracts, you know, cataract patients, they've got like this white film on the top of their eye. Well, that's what his eyes did. And there's no fixing that. Because with the laser, it cuts off part of your eye. So there's no way that they can take the laser back in there and burn off that section of pretty much scarred tissue that's on his eye. So his best vision that he could possibly get, and that's correctable with glasses, is 2100. He cannot drive ever again because 2040 is legal in all 50 states. You don't want to screw around. Just do the freaking drops. I don't know if that's like an extreme case where it's a scare tactic or whatever, but it worked on me. So just take them. I just did some eye drops a minute ago. It wasn't too bad, and I'm horrible with eye drops. So if I can do it, you can sure as hell do it. So just freaking do it. Like I said, I'm going to get off here. I'm going to take a nap. I'm going to take my pill, take a nap. I'll see how I feel whenever I get up. Like I said, I'll try to keep this video segment updated as best I can, but it's going to be tough. It's going to hurt, but I'm ready for it. So all you guys out there wanting to get it, my suggestion is so far, it ain't bad. Do it. Do it, do it, do it, because it's awesome.